All right. We're doing our mobility challenge today. And if you see me looking to the side, yes, I'm looking at a couple of notes for today because I saw that I left something out yesterday in my outline, but we're gonna talk about what we're gonna do today. And hopefully you did your homework. Did you do your homework? Okay, if you did your homework, tell me what video you found on YouTube yesterday or on Gaia. You were supposed to do at least 10 minutes of some type of stretching exercise that was designed for helping you to go to sleep last night. So I'm looking forward to hearing that from you. And today, the mobility challenge, we're in the second day of the mobility challenge. And today we're gonna focus on strength. And I realized that I left out endurance, which is a big part of mobility too. So yesterday we talked about flexibility, and flexibility is talking about like your joints and your range of motion of your muscles, your ligaments, which is a very important component of mobility, especially as we age, because as we age, the muscles tend to tighten up. And if you don't stretch, what'll happen is you'll get what we call contractures, especially if you have medical issues, like if you've had surgery, or if you've had any part of your body like injured or damaged. Those are the first places that you'll develop scar tissue, and the scar tissue will keep the fascia from sliding on itself. Fascia covers your entire body from head to toe, and it's like a sheet. It looks like a white sheet when we look at it, when we're looking at anatomical specimens. And it's very tough, kind of like rip cloth, or I forgot what that cloth is. You make tents out of, they make luggage out of it. That's what it's kind of like, tough like that. And your ligaments and your muscles actually attach to it. This is important to know, because if that fascia is not moving the way it's supposed to move, that takes away your muscle strength. And that's what we're talking about today. We're talking about strength. You need to have strength in your muscles in order to make certain motions. And one of the areas where I see people having a lot of problems is in the knees and in the hips, and I would say spine too, as far as mobility goes, and simple mobility like walking, like standing. So in the elderly, the walking and standing becomes important, especially when it comes to balance and fragility. The less mobile you are when you're older, the more fragile you are. So with strengthening, you can't really start strengthening your muscles until you're flexible and until you have full range of motion in your muscles and your joints. And nowadays, instead of so much weightlifting, I talk to people about functional strengthening. So using the body weight, using things that are normally used on an everyday basis. Like if you're lifting groceries, you're lifting like gallon jugs of milk or water. Those are things that could be used for strengthening. Also, like if you're pulling, like every day I'm pulling a hose to water my garden, and you have to have some strength to pull the hose, to guide it to the right area, to water the plants. So you need to have strength, you need to have balance. So today, let's see how much time we have left. We just have a few minutes. What I wanted to get us to do today was if you have a balance board, and I don't have mine up here today, but it would be on the floor, so you probably wouldn't see it too well anyways, but I'm gonna stand back a little bit. I'm gonna angle the camera down. Let's see if I can turn on my other camera here. Yeah, so I'm gonna stand back a little bit, and what we're gonna do today requires some range of motion in the knees, in the hips. You need some in the spine because the pelvis is gonna be rocking back and forth. And what we're gonna be doing is doing just simple squats. Squats are a tremendous exercise because you help to strengthen the hamstrings, the quads, the tibialis anterior in front of the calves. It requires some minimal use of the calf muscles. And if you do squats like standing on your tippy toes, you can really bring some of those calf muscles into the fray or into the play. Also, the glutes, certain parts of the glutes are involved with squatting. Like if you go to the gym or if you put things on your shoulders to add weight, that can add difficulty to the squats. But we're going to start squatting right now. And I'm just going to do a squat where I'm looking down and I can see the tops of my toes. And I'm sitting back like I'm trying to sit back in a chair, and then coming back up and straighten the knees all the way up. And I'm gonna bring my arms up, and that's gonna make it a little harder. And then come back up, go down, and come back up, go down, and come back up. Let's see if I can angle the, hello, Jean Vive, welcome. We're doing a mobility challenge today, and today we talked about strength. I am doing squats, and the good thing about squats too is we're working with the spine. We're working with holding the head erect. We're working with knee range of motion, hip range of motion, ankle range of motion. And if you wanted to make this harder, just doing this in place, you can also stand up on your tippy toes. And I'm trying to hold my balance. I would say the tippy toe is harder here because I'm on carpet. And if you wanted to make this really hard, if you had a balance board and you were doing squats on top of the balance board, those wobble boards, that makes it even harder. I went to Pilates this morning, so my muscles are shaking. But, you can get a good workout just doing these simple squats. So, yeah, so that's enough for me right now. You all can work on doing some squats tonight after I get off of here. Maybe you can do like 20 squats in place. If you have a wobble board, you could do that. And if you're up to it, you could do like 3 sets of 20 of the squats. You could do that flat-footed, or you could do it on a wobble board. And that will be your homework for me. And I keep these short. I started at about 2 or 3 after the hour. If you have any questions, just throw them up in the chat. Oh, hey, Harper. It's good to see you. All right. So if you have any questions, just post them in the chat and I'll try to answer them. I'm next live tomorrow. Thanks for asking. I'll be on at 6 p.m. And tomorrow we're going to be talking about coordination. I will mention, I mentioned that I was needed to talk about endurance today. And you can see that I was a little bit breathing hard. after I did a few squats. So as you grow older, you still need to work on endurance. You don't need to be able to run like 10 miles, but I would say if you're a walker or a runner and you're over 40, 45, you should be able to run a mile. You don't have to run it super fast, but you should be able to jog a mile just to have decent endurance. Or you could walk, be able to walk several miles. That's what we expect in physical medicine and rehab. There are certain tests that we do for a much lower level of endurance when we see patients in the hospital. But I would say that someone who, you know, is of normal health should be able to walk several miles in a reasonable amount of time. And I would say a reasonable amount of time is a mile should be able to, you should be able to do a mile in like 15, 20 minutes tops, and you can do it faster. And running is the best, but running, you just need to be able to do a mile running, okay? All right, so tomorrow we're going to talk about coordination and balance and the importance of that. So your homework today is to do 20 squats, if you can, in place on flat foot. If you can do more, do 3 sets of 20. All right, I look forward to seeing you tomorrow. Great to see you here today. Take care. Thanks for coming. Bye-bye. Okay. Bye-bye.